Thanks for joining us for our weekly On Call for All Kids segment, where we're discussing trending pediatric healthcare topics with our Johns Hopkins All Children's experts. Today we're talking about kids and emergencies. We'll find out the first thing you need to know in an emergency situation, whether to head to the emergency center or choose your local pediatrician. I'm joined by Dr. Joe Perno today, our Vice President of Medical Affairs. And Dr. Perno, you say there is one major thing that you need to know, especially if you're about to call 911.
Yeah, and the most important thing is stay calm. And it's easier said than done. This is probably the scariest moment of your life, but the more calm you could be, the better you're going to help your child. You'll be able to give information to the 911 operators and really help determine what the next step are. Or if you're being called from your child's school or camp, you'll be able to get the appropriate information you need to know at that point.
And I imagine it's pretty helpful if you have lists of allergies, medication on you.
Absolutely, right. So you want to know your child's allergies. If they have a long list, keeping it in your phone is great. Same thing with medications. It's going to be vital to the paramedic team, eventually vital to the ER team, is knowing what medications they are on. And if they're on more than one, it's a great thing to have it in the phone. It's the most handy thing that I can have, because that's going to help guide therapy and help the teams care for your child.
And I know depending on the emergency, a lot of parents may be at home or at a location and they want to know, should I drive to the emergency center or do I call 911 for an ambulance? What are your tips?
Yeah, this is always a tough one, right? Is parents' instinct is, well, if I just throw my child in the car, I'll drive like a crazy person, I'll be at the ER quicker. But that's not exactly the best thing. So if there's any chance of difficulty breathing, change in the behavior, anything concerning, they need to call 911. Paramedics can get there, they could start therapy that the parent can't start. The flip side is if the parents can perceive it as an emergency, 911 is always the right answer. The worst thing they could do is drive here like a crazy person. They're putting themselves in jeopardy, they're putting their child in jeopardy, they're putting others on the road in jeopardy, and the child's getting no treatment during that time period. So if there's any question at all, always calling 911. Driving with one eye on the road and one eye on your child in the back seat is not the best for anyone.
And remaining calm, as we've already
It's so easy
before
to say, but it's so hard to do. But the calmer parents are able to give us a much better history of what's gone on, much better details, which enables me to care for the child so much better.
Very good. So if a family does have to come to our emergency center, any emergency center, what are some of the things that they need to know to maybe better prepare, if at all possible, of course?
Absolutely. So we're going to hit you with a bunch of questions right as you walk in. So we're going to want to know the immediate events, what's gone on today or the preceding days that led you to being in my emergency department. I'm going to want to know things like, when was the last time the child ate? I'm going to want to know those questions about allergies and medications they take, medical problems. It's easy if they have one problem, but if they have a long list of problems, again, you may be panicked. If it's written down, that's always helpful also. So those are the kind of things that I'm going to be asking, because I'm going to try to build a picture of what's going on with your child. So having those things either handy in your phone or just knowing them cold is going to help us treat your child so much better.
And we know there's a lot of anxiety anytime somebody has to come to the emergency center, but especially our little ones. What are some of the things maybe our team or parents can do when they arrive at the emergency center?
Yeah, so it's a scary place, right? I mean, even a children's ER is a scary place for a child. So trying to comfort your child, the parents know their children the best, so they know what kinds of things can comfort the child. Fortunately, most pediatric centers have Child Life available, and they're a huge resource for us because they could distract the child, they could calm the child, which in turn allows me to get a better exam and a better picture of what's going on. Is the child crying because of pain or just crying because they're scared? And those are the kind of things that can really help us. So yeah, that's the difference in going to a children's ER, is they have those resources. If you're not there, then the parents need to rely on their own skills of calming in the child, whether it's a game on the phone, whether it's a special stuffed animal, whatever it may be. But keeping the child comfortable and calm, just like yourself, can go a long way in how we're able to treat the child.
And I know we have a great Child Life team here.
Fantastic. They are a huge part of our team here.
And then the last question that we have is, how do you know when you should go to the emergency center, or do you go to visit your local pediatrician? There's a fine balance sometimes.
It can be a tough call, and depending on time of day, weekend versus weekday, you're going to make those decisions. There's some basic ones, right? Some of the common questions I get from parents is, my child's got a fever. Do I need to come running into the ER? Can it wait to see my doctor tomorrow? And those are the kind of things they need to think through, and think through ahead of time. It's always best to have those thoughts kind of in your head before it actually happens. But for fever, if it's a young child, someone under the age of 4 months, if they've got fever over 100.5, they actually need to be seen in the ER pretty emergently. So that's one of those where I'm going to say, yeah, you need to come visit me in the emergency department. Older children, if they're happy, playful, fever can be controlled with anti-fever medicines, that can wait for a next day visit to the pediatrician. You don't need to pack them up in the middle of the night to come to the ER. Things like swallowing an object, that's a common thing that toddlers will do. So thinking through, are they having trouble breathing, swallowing, drooling? That's an immediate come see me, maybe via 911. Otherwise, if they're doing well, if you know what they swallowed, that it was a piece of plastic or something harmless, no worries. If you're not sure what they swallowed, you better come see us. And then lastly, if they drink anything they shouldn't, right? Chemicals, poison, whatnot, call the Poison Control Center. That number should be posted everywhere around, 1-800-222-1222, pretty easy number to remember. They're going to guide you whether it's a stay-at-home emergency or a come-see-me emergency.
Another reminder to have that on our phones,
stickers on the phone,
the refrigerator,
you got it.
Everywhere. Great tips that we hopefully never have to use, but feel better prepared now. We thank you for watching, and of course, if you have any comments or questions for Dr. Perno, you can comment below. You can also send us any ideas that you might have for healthcare topics around children. We hope that you will visit HopkinsAllChildren's.org/newsroom for the latest stories about Johns Hopkins All Children's Hospital or other pediatric trending healthcare topics. We hope to see you next time.